And now to the next item. The COVID pandemic is pushing many to the very limits of their mental health. At the forum, we want to give this widespread aspect of the global crisis the attention it deserves. And so, here to discuss the urgent need to address mental health concerns and the necessity of mental care in all health systems are conversationists Jess Phillips, Elisa Tarazona Gines, Hauwa Ojeifo, and Marie-Louise Coleiro Preca.
Well, I'd like to welcome everybody from Malta. I'd like to welcome in particular all the panelists and all those who are following this panel on mental health, as has been described, which is being held during the Reykjavík Global Forum for Women Leaders. We might not be meeting physically this year to enjoy the warm welcome, the usual warm welcome of the leaders and people of Reykjavík, but I am proud to say that despite all this, women political leaders and the government of Iceland has made it possible through technology to bring us together on a virtual global platform, to share our experiences and to further resolve ourselves to gender equality. I am sure that the distance has not diminished our passion to make the world a better place, especially now when there is so much need to heal the world. We all appreciate how COVID-19 has disrupted every facet of our lives. And research is also showing us that the pandemic is also seriously affecting our mental health. And in this context, I must commend women political leaders for taking the initiative to carry out a research study among political leaders on mental health in the European Union member states, in collaboration with Centene, a healthcare company based in the United States. But without much further ado, I would like now to welcome our speakers, Jess, Elisa, and Hauwa, and I'd like to thank you for joining us. And we shall start now our discussion. And I will start with you, Jess. As a politician, and I'm sure that you acknowledge that COVID-19 is dominating current policy debates and is stretching our healthcare systems. I would like, therefore, to pose the following question to you. How do we ensure that mental health support is made available and is accessible to people during this crisis and over the longer term, even post-COVID? Jess?
Well, thank you very much, Your Excellency, and it's a pleasure to be here from the United Kingdom Parliament, which is where I'm sitting. I think that the truth is that certainly my experience in my own country, but also elsewhere, is that we shouldn't kid ourselves that mental health support was widely available prior to the crisis. And that whilst the crisis has definitely exacerbated and potentially grown the number of people who feel that they need support, the likelihood and availability of support for mental health issues prior to the crisis certainly was not something that I think that people feel is accessible as if they were to break their arm or their leg and seek healthcare treatment. I think personally, specifically when we think about the experiences of women, we have got to not just have the umbrella term of mental health problems. We have got to call these things what they are often. And these are trauma-induced psychosis, for example, based on life experience such as domestic abuse, sexual violence, other traumas that people have suffered in childhood. We need to talk about substance misuse, which very often gets forgotten in the overall heading of mental health problems. And I worry that for quite a long time, the conversation that politicians in the Western world have about mental health, the idea of awareness raising being very important and destigmatizing is truly, truly important. But I worry sometimes that lets politicians off the hook of actually providing active services for citizens to access. And it's become a sort of checkbox, and we need to do much, much more to ensure a parity of esteem in the funding of our healthcare and welfare when it comes to mental health services rather than just our physical health services.
Thank you so very much, Jess, for putting into context our conversation. And now I would like to turn to Elisa. Elisa, I am informed that the women political leaders should be finalizing the research study on the attitudes of EU politicians towards mental health by early 2021. And I would like to ask you, using your own country as an example, what are people's attitudes towards mental health, and what approaches are emerging as this crisis continues to deepen and expand?
Okay, good morning, dear colleagues and participants. First of all, I would like to say thank you for your invitation to participate in the forum. I'm most honored to be here today. As Marie-Louise said, Centine and Ribera are cooperating with the Women Political Leaders Project, surveying political leaders looking at how mental health issues are addressed in the EU member states and the UK, specifically in areas such as access to treatment, awareness, acceptability, and affordability. Such a report is, of course, even more relevant during and after the COVID-19 crisis, and this report will be ready in early 2021. In Ribera Salud is a healthcare company with a focus on the citizen, the patient, and the caregiver. It provides integrated health services in primary care, at home, and in hospitals, based on a public-private partnership with different governments. The company employs more than 6,000 professionals, of whom 70% are women, mainly doctors and nurses. Right from the onset of the pandemic, and based on the other experiences, we became aware that in addition to treating the COVID infection, we had to take care of the most vulnerable population groups as those with the highest risk of mental disorders. A care strategy was defined for the prevention and early detection of mental disorders in our professionals. They are the first line of action, and they are therefore exposed to stress and fear of infection themselves or their loved ones, and to having to make tough decisions about their patients. A program was launched called We Take Care of Ourselves. It was intended to provide both individuals and groups with immediate, comprehensive, and multidisciplinary counseling, with a view to preventing future pathologies. Of the almost 700 health workers participating in the program, the average user profile was woman aged between 25 and 35 years old, with a partner and young children, with a high sense of responsibility and high self-demands, with a need to control situations, and a high level of affectivity and emotionality. On the other hand, to improve care to our patients and their families, and to face social distancing, isolation, and quarantine measures, we made the most of our digital transformation project by promoting the use of telemedicine with telemonitoring, video consultation, and telepsychiatry through our health portal, Eurochild. Also, our home hospitalization service was also promoted to a great extent to attend to patients and their families at home on a face-to-face basis. Thank you.
Thank you so much, Elisa. Thank you for that very informative contribution. And now I would like to invite Hauwa. Hauwa, as founder of She Writes Women and mental health advocate and coach, you have turned trauma into hope and support for many women. So I would like to ask you to share with us, how can we give mental health the urgency it deserves and overcome the stigma that unfortunately still exists?
Thank you so much, Your Excellency. And first, I just want to say thank you so much for having me at this forum. It is an absolute pleasure to be here. So yes, I believe, first as a person who has a lived experience of mental health, it is a pleasure to be here to share my experience and to share how my story has been able to ignite hope and support for, people who live with mental health conditions in Nigeria and also beyond Nigeria, and, which is testament to the work that we do at She Writes Woman. So I believe there are three core things we need to, be able to put at the front burner in order for us to really address the issue of stigma, but also for us to normalize mental health conversations across the board. One of the first things that I'll talk about is we need to first start at a place where we are promoting, protecting, and realizing the fundamental human rights of persons with mental health conditions. Like in Nigeria and many other countries, we find that persons with mental health conditions are being subjected to harsh, situations and conditions such as shackling and, forced treatments and irreversible treatments, which are violations of the fundamental human rights. And there is so much that we can do systemically to ensure that, that top-down approach to how we're dealing with, mental health and how it is being perceived by the society, how we address it, how we view it, and how we communicate it are very strong or, really pass strong messages to how, mental health is really accepted as a general thing, a general issue, as against an us versus them issue in any society. So we might want to also begin to review and, re-examine our mental health legislation to ensure that there are human rights respecting legislation and policies. The second thing that I definitely want to touch on is we need to deliberately give way to new stories around mental health. Again, as a person with lived experience, one of the things that we do at She Writes Woman is that we're putting people who actually live with mental health conditions at the forefront of telling their own stories, of co-creating their own solutions, and advocating for their own rights. And this is very much, in line with the tenets of the United Nations Convention on the Rights of Persons with Disabilities, which is nothing about us without us. It is realizing that, this group of people, we the people who have mental health conditions, are not people that, need fixing or, the world needs to sit down and deliberate how to fix them or how to deal with them without actually ensuring that there is a space at the table, for us to be able to share what our concerns are, to share what support looks like for us, and to, co-create what a mentally healthy society really looks like, for us. So I think there's a lot of work that we need to do regarding that, which can potentially change how we look at mental health and, by extension, reduce or destigmatize any given country or society. And of course, the third thing that I'll talk about is that we need to start shifting how we look at mental health from this biopsychosocial, biomedical approach or aspect to something more psychosocial. And the reason why this is so important is that when we rely on the latter, what we're really doing is that we're making mental health this thing that it's only illness-based, like, oh, it's an illness that needs to be treated. But a lot of times what is really happening is that on a level of shared experience, on one level or the other, in a certain kind of degree, we all know what it's like to face anxiety or to have stressors. For example, the COVID-19 pandemic, in Nigeria, we're having a lot more with regards to the EndSARS protests and the consequent killings and massacres. We are realizing that, you cannot actually separate the effects of poverty in a country from the mental health outcomes of the people within the country as well. So it is absolutely important that we need to begin to make room, and we need to start normalizing mental health issues and conversations from a place that is from more cross-cutting issues and shared experiences, and opening up for more unashamed conversations and leaning into, shared experiences. So I would say these are three things that personally and as an organization, as She Writes Woman, we are continuing to do with regards to destigmatizing and promoting mental health.
Well, thank you so much for your inspiring contribution. And we have some more minutes, so I would like to ask maybe the same question to the three of you. We have like 5 minutes to go. And well, I think it would be extremely interesting to also the people who are following our conversation here to sort of ask you, what would be the one action you would ask this community of people, from the women political leaders, to take now in this situation where we know that, unfortunately, the issue of mental health has now increased, and it is an urgency. One could say it's an urgency due to the effect of the pandemic. So shall I start with you, Jess, again?
Yeah, I mean, I think that what we have to do, I mean, firstly, with regards to the pandemic, as political and women leaders across the world, I think that the first and foremost, I think we've got to try and take care of those who have been caring for us, and to make sure that those dealing with the trauma and crisis that is occurring in any country, whether that's the pandemic or, as Hauwa said, issues of violence occurring in a country, is that in order to properly care for the people who are doing the bulk of the work to try and protect our nations, which are often women, we need to make sure that we are putting in place proper resources led from experts by experience, as Hauwa said, to take care of those people who are caring for our people at the moment. And that is the most short-term thing. And then I suppose in the long term, we must lobby for the resource base for mental health services to be considered as an important in our political will as we consider physical health of our citizens, because they are inextricably linked, and they are inextricably linked to poverty in exactly the same way.
Thank you so very much, Jess. And Elisa?
Yes. Okay, as we all know, the role of caregivers that has traditionally been assigned to women must be taken into account when addressing this crisis. Maybe because ignore this gender-based impact within the economic and social consequences of the pandemic will only make inequalities worse. And then to avoid that situation, women need to play a part both in the direct response and in the decision-making process. I think it's very important women have to be leaders in the management of this crisis, because we are in the first line of this crisis.
Thank you so very much. And now, Hauwa, would please your input?
Yes, absolutely. Very much in line with what Jess said. I believe, now more than ever, immediate first response. I mean, I believe that many of the countries who are responding better to mental health, especially given the pandemic, are countries who have had certain kinds of systemic, changes, or have done certain things with regards to systems in order to, be proactive about dealing with, such a time as this. But I think the next best time is now. It's really about how can we ensure that we are putting certain kinds of structural, processes in place, or, really beyond just a piece of paper in terms of legislation. How are we ensuring that, we're actively creating infrastructure for mental health? So, for example, given the Nigerian context, we don't have mental health at the primary healthcare level, and that is a big issue, because for a lot of people, as your rights woman, we're trying to plug in these kinds of gaps. But the truth is, we're still excluding the most vulnerable people, and we're still leaving the furthest, we're still not reaching the furthest behind first. And that is particularly, important, because these are the people who are most marginalized and are most vulnerable to mental health issues during times like this, given, social class, given poverty, given level of education, and all of those things. And so I feel like in the interim, or at least the most immediate thing that we can do, especially in the context of Nigeria, is to really ensuring that how can we bridge that gap? How can we create more resources and infrastructure at primary healthcare, get it as close to home as possible? And of course, long term, again, is about ensuring that we are creating legislation, we're creating systems that are proactive in not just, waiting for the next pandemic or, waiting for dire situations, but ensuring that how are we always thinking about the furthest behind? How are we always thinking about the most vulnerable people? How are we thinking about persons with disabilities, who are most often forgotten when it comes to issues around mental health? And then how are we ensuring that mental health is not just something for people with mental health conditions, but how are we ensuring that the general population, is being reached with accurate knowledge and information with regards to mental health?
Well, Jess, Elisa, Hauwa, thank you so very much for your amazing contributions adding to the discourse of mental health. We definitely need to take this discussion forward. It is important that all of us advocate with our policymakers to push mental health on top of our country's agenda, now more than ever before, I would say. We need to advocate for more engagement on mental health to address the still existing stigma that exists with it. At the end, I'm very proud to say that today's forum is another achievement of women political leaders in addressing current issues in real time and which are so important for our families, our communities, and our world. I really thank you once again, and I wish us all a fruitful forum. Thank you.
Thank you.
Thank you so much.